This is Professor Capron. Today, for Fundamentals of Nursing, we're going to discuss the pulse. This information can be found in your ATI Fundamentals of Nursing textbook, Chapter 27, and your Taylor's Fundamentals of Nursing textbook, Chapter 26. Let's explore how the autonomic nervous system, a vital part of our body's internal control system, regulates our heart rate. This might sound complicated, but I'm going to break it down for you. Imagine a control center in your body that manages functions that you don't have to think about consciously, like breathing, digestion, and yes, heart rate. This control center is known as the autonomic nervous system. The autonomic nervous system, or ANS, operates in the background, making adjustments as necessary to keep your body functioning smoothly. It's divided into two parts, the sympathetic and parasympathetic nervous systems. The parasympathetic nervous system is like the body's rest and digest system. It helps to conserve energy and maintain a state of calm. When the parasympathetic system is in action, it slows down the heart rate. It's like applying the brakes in a car. This slower heart rate allows the body to focus on functions like digestion and conserving energy. Think of it as the body's way of saying, let's take it easy and focus on restoring and conserving our energy. On the other side, though, we have the sympathetic nervous system. This is the body's fight or flight response system, preparing you for action. When activated, it does the opposite of the parasympathetic system. It speeds up the heart rate. Imagine pressing the gas pedal in a car. This increased heart rate prepares the body to respond to stressful situations, like running away from danger or facing any other challenging situation. The sympathetic system pumps more blood to muscles and critical organs, ensuring that they get the oxygen and nutrients they need quickly. These systems work together to maintain a balance in heart rate based on the body's needs. If one system steps on the gas, sympathetic, the other is ready to press the brakes, parasympathetic, and vice versa. As nurses, understanding how these symptoms influence heart rate is crucial. It helps us to interpret changes in heart rate and understand a patient's response to stress, rest, medications, and other medical conditions. So the autonomic nervous system, with its sympathetic and parasympathetic components, plays a crucial role in heart rate regulation, ensuring that our heart beats as it should in different situations. Let's talk about the expected heart rate range. Understanding this range is crucial for assessing a patient's cardiovascular health. Normally, an adult's resting heart rate ranges from 60 to 100 beats per minute. This range represents the heart working efficiently with minimal strain while adequately supplying the body with oxygen-rich blood. A heart rate slower than 60 beats per minute in a resting state could indicate an exceptionally efficient heart, often seen in athletes, or it could signal a medical problem. On the other hand, a resting heart rate faster than 100 beats per minute might point to stress, illness, or other medical conditions. When we assess someone's pulse, we're looking at several key factors: rate, rhythm, strength, and equality. Rate is the number of beats per minute. As mentioned, the expected range is 60 to 100 beats per minute at rest. Rhythm refers to the regularity of the pulse. A regular rhythm means that each beat comes at an even interval. Irregular rhythms might suggest a variety of heart conditions or responses to medications. Strength is also known as amplitude or pulse volume and reflects the blood flow from the heart to the arteries. Each pulse should feel about the same in terms of strength. We often grade pulse strength on a scale from 0 to 4, where 0 is absent and 4 indicates a bounding pulse. And equality means comparing pulses on both sides of the body to ensure they're equal in strength and quality. Significant differences can indicate circulatory problems in specific areas of the body. A regular rhythm with beats of consistent strength usually indicates a healthy, well-functioning heart. It suggests that the heart is pumping efficiently and rhythmically, providing consistent blood flow. Variations in rhythm or strength can be clues to underlying health issues. For instance, a weaker pulse in one arm compared to the other might suggest a blockage in the arteries leading to that arm. So understanding the expected heart rate range and characteristics of a healthy pulse, rate, rhythm, strength, and equality, is essential in assessing cardiovascular health. I want to focus a little bit more on assessing the pulse, particularly focusing on amplitude and pulse equality. Let's talk a little bit more about amplitude. Again, this is known as pulse volume. It refers to the force or strength of the heartbeat as it is felt through the arterial walls. It gives us an idea of the volume of blood being ejected with each heartbeat and the condition of the arterial system. Amplitude is graded on a scale from 0 to 4. This grading helps us quantify the strength of each heartbeat and provides a standardized way to communicate pulse strength. 0 represents an absent pulse, meaning no pulsation is felt despite extreme pressure. 1 plus or diminished indicates a weaker than expected pulse, possibly due to decreased cardiac output or peripheral vasoconstriction. 2 plus or brisk is considered a normal and expected pulse, easily palpable with moderate pressure. 3 plus or increased suggests a stronger than normal pulse, and this could be due to things like high blood pressure or increased cardiac output. And finally, there's 4 plus or bounding. This signifies an extremely strong pulse. This is often associated with certain cardiovascular conditions, fluid overload, or even in some cases, anxiety. Checking the equality of pulses involves comparing the pulse on one side of the body to the other, typically at symmetrical points, such as both wrists. This comparison is crucial because unequal pulses can indicate vascular issues, such as blockages or obstructions in the arteries. For instance, a weaker pulse in one arm compared to the other might suggest a narrowing or blockage in the artery leading to that arm. This can be an important sign of peripheral vascular disease or other circulatory problems. Amplitude and equality assessments give us vital clues about the health of the heart and blood vessels. They signal variations in blood flow and vascular resistance, which are key indicators of cardiovascular health. So please remember that these important assessments have to take place, not just counting the rate. Let's discuss some special considerations that you should keep in mind when assessing a patient's pulse. Understanding these nuances is crucial for accurate evaluation of cardiac health. Dysrhythmias, also known as arrhythmias, are abnormalities in the heart's rhythm. They can lead to irregular heart rhythms and pulse rates. Normally, the heart follows a regular and predictable rhythm set by its natural pacemaker, the sinoatrial or SA node. However, in dysrhythmias, this rhythm is disrupted. This disruption can be due to electrical signaling problems in the heart. Irregular heart rhythms can result in the heart beating too fast, too slow, or in an erratic pattern, leading to irregular pulse rates. For instance, atrial fibrillation, a common type of dysrhythmia, causes a rapid and irregular heartbeat. A pulse deficit occurs when there's a difference between the apical pulse rate, heartbeats heard with a stethoscope over the chest, and the radial pulse rate, which is the pulse felt at the wrist. Why does this happen? In some cardiac conditions, not every heartbeat is strong enough to push blood all the way to the peripheral areas like the wrist. This means some beats may be heard at the chest, but not felt at the wrist. A pulse deficit indicates that the heart may not be contracting effectively, reducing its efficiency in circulating blood. This can be a sign of conditions like heart failure or valve disorders. Age significantly impacts expected pulse rates. Generally, infants and young children have faster heart rates than adults. A newborn's heart beats much faster than an adult's because their heart and blood vessels are smaller, meaning that the heart needs to work faster to circulate blood effectively. As a child grows, the heart rate gradually slows down. By adolescence, the expected heart rate is closer to adult values, ranging from 50 to 90 beats per minute depending on activity level. Understanding these age-related differences is important for correctly interpreting pulse rates in different age groups. Let's discuss the essential equipment needed for pulse measurement and how to use it. This is a fundamental for all nursing students to grasp. When measuring the pulse, it's crucial to count the number of beats accurately. This is where a clock or a watch with a second hand, or a digital clock with a seconds display comes in. You need to measure the pulse rate in terms of beats per minute. To do this, you count how many beats occur within a specific time frame, usually 30 seconds, and then multiply to get the rate per minute. For instance, if you count 40 beats in 30 seconds, you're then going to multiply that 40 by 2 to get 80 beats per minute. This method provides a quick and accurate measurement of the heart rate. To measure the radial pulse, which is located at the wrist, you'll use your fingers, not your thumb, as your thumb has its own pulse, which can be misleading. You'll gently press the index and middle finger over the radial artery, which can be found on the thumb side of the wrist. Feel for the pulse and count the beats. This method is commonly used because it's quick, easy, and non-invasive. It's suitable for checking the heart rate in a variety of settings, from hospitals to community health clinics. Using a stethoscope can give you a more precise measurement of the heart rate, especially in cases where the pulse is faint, irregular, or very rapid. That's when we want to use that stethoscope to listen to the apical pulse. The apical pulse is located at the apex of the heart, which is best heard at the fifth intercostal space at the left clavicular line, essentially the left side of the chest, just below the nipple line. Using a stethoscope allows you to listen directly to the heartbeats, which gives a more accurate count, especially in cases of arrhythmias or pulse deficits where the radial pulse may not provide a complete picture. Let's look a little more closely at the procedure for measuring pulse. This involves steps that ensure accuracy and respect for the patient. Before starting any clinical procedure, hand hygiene is essential. This is to prevent the transmission of germs to or from the patient. Remember, as nurses, we must always prioritize patient safety and infection control. Providing privacy is also crucial. It respects the patient's dignity and ensures they feel comfortable and secure during the assessment. This can also help in obtaining a more accurate measurement as the patient is relaxed. To measure the radial pulse, you'll use the radial artery located on the wrist. This is a common site for pulse measurement because it's easily accessible. Use the pads of your index and middle fingers, not your thumb. Place these fingers gently but firmly on the patient's wrist on the thumb side. Count the number of beats for 30 seconds and multiply by 2 to get the beats per minute. If the rhythm is irregular, count for a full 60 seconds to ensure accuracy. The apical pulse measurement is a bit more involved and is used when a more precise heart rate is needed or when the radial pulse is difficult to access. Place the diaphragm of your stethoscope at the fifth intercostal space, the space between the ribs, at the left midclavicular line, a vertical line down from the middle of the collarbone. This location is where the apex of the heart, or the point furthest from the heart's attachment to the chest wall, is located. Once the stethoscope is correctly positioned, listen and count each heartbeat. Just like with the radial pulse, count for 30 seconds and multiply by 2 for a regular rhythm, or for 60 seconds if the rhythm is irregular. Remember, proper hand hygiene and ensuring patient privacy are foundational to any clinical procedure. Now we're going to discuss tachycardia. This is a common complication in pulse regulation. Understanding tachycardia is crucial for identifying potential cardiovascular issues in patients. Tachycardia is a condition where the heart rate exceeds 100 beats per minute. It's not just about the heart beating fast. It's about it beating faster than what is considered normal at rest. This accelerated heart rate can diminish the heart's efficiency in pumping blood throughout the body. When the heart beats too fast, it may not fill with blood adequately between beats, leading to a decrease in blood flow to the rest of the body. Several factors can trigger tachycardia. Common causes include physical exercise, fever, stress, and some medications. During physical activity, the body requires more oxygen, so the heart compensates by beating faster to circulate more blood. In response to illness, the body raises its temperature. This increases metabolic demand, which can then speed up the heart rate in order to meet the increased oxygen needs of the increased metabolic demand. Some drugs like epinephrine, levothyroxine, or beta-2 adrenergic agonists such as albuterol can stimulate the heart and cause an increased heart rate. Emotional or psychological stress activates the sympathetic nervous system, which increases heart rate as a part of the fight or flight response. So, we want to monitor for low cardiac output. A heart that's beating too fast may not pump blood effectively, and this leads to low cardiac output. Signs to watch for include fatigue, dizziness, hypotension or low blood pressure, chest pain, and low oxygen saturation levels. Patients with tachycardia might feel dizzy or lightheaded, and this increases their risk of falls. Ensuring patient safety is a priority. You want to determine the underlying cause of tachycardia. This might involve reviewing the patient's medications, assessing for signs of infection in the case of fever, or providing interventions for stress reduction. So remember, tachycardia is a condition where the heart rate is abnormally high, can be caused by various factors, including activity, fever, certain medications, and stress. Now let's discuss bradycardia. This is a condition characterized by a slower than normal heart rate. Bradycardia is defined as a heart rate slower than 60 beats per minute. It's important to note that a slow heart rate isn't necessarily problematic. In fact, it can be normal for some individuals, particularly those who are physically fit. The heart of a person with bradycardia pumps blood less frequently. This doesn't automatically mean it's pumping insufficiently. The heart may still pump an adequate amount of blood to meet the body's needs. Various factors can contribute to bradycardia. These include high levels of physical fitness, some medications, and being incredibly relaxed. Athletes or physically fit individuals often have slower heart rates because their hearts are more efficient at pumping blood. This efficiency means their hearts don't need to beat as frequently to circulate blood effectively. Some drugs, particularly those affecting the heart, like beta blockers or calcium channel blockers, can lower the heart rate. These medications are often used to treat high blood pressure or other heart conditions. And during deep relaxation or sleep, the body's metabolic demands decrease, so the heart rate can naturally slow down. While bradycardia isn't always a cause for concern, it is important to monitor for signs that the heart might not be pumping enough blood to meet the body's needs. Symptoms to watch for include dizziness, weakness, fatigue, low blood pressure, chest pain, and shortness of breath. Due to potential symptoms of low cardiac output, ensuring patient safety is crucial. This includes helping to prevent falls and providing assistance with activities that may be challenging due to the symptoms. If the patient is on heart rate lowering medications, regularly evaluate the effects and consult with healthcare providers if the heart rate becomes too slow.